Kia ora koutou, ko Elliot Bell, taku ingoa. I am convening REHB714, Personal and Psychological Factors in Rehabilitation at the RTRU for 2021, Semester 1. I'm a clinical psychologist by trade, and I work as a senior lecturer both at the RTRU and the Department of Psychological Medicine here at the University of Otago in Wellington. In terms of my clinical background, I spent a long time working in public mental health services, working with clients with chronic psychiatric conditions in a rehabilitation setting. So I've worked in hospitals and in the community and in prisons. I'm going to be teaching REHB714. I think this is the 11th iteration of the course. In terms of my research and teaching and practice focus, I've got a particular interest in cognitive behavioural therapies, which they're a group of evidence-based psychological treatments for mental health conditions. Within REHB714, there's sort of a story or a narrative to the paper, and it has three sections, if you like. And to start off with, we'll look at this notion of personal factors, and which are the aspects of someone that if you take away their physical health condition, these things remain the same. So we'll start off by looking at personality and personality theories, particularly the trait models of personality. So we sort of start in this normal psychology space. Then in the second kind of phase of the course, or section of the course, we'll look at more abnormal psychology and psychopathology, and you'll get an understanding of the way mental illnesses are categorised, and learn a bit about some of the more common mental disorders like anxiety and depression and how they're best treated. Now, it's really important for rehabilitation practitioners to have an understanding of psychopathology, because there's a very high level of comorbid mental health conditions in people with chronic physical health conditions, and the disabling effect of these two conditions together can be synergistic. So the whole can be greater than the sum of the parts in terms of the disabling effect these two things can have. So that's the second phase, and then in the third phase we move more towards, I guess, what you might call positive psychology and the psychology of resilience and even post-traumatic growth, which is a notion of how something bad can happen and you can grow as a person because of it. Through the three sections of the paper, the idea that I'm trying to promote, or at least challenge you to consider, is that there's this axiom within medicine that the disability a person has is less important than the person a disability has. So it's this notion that just because you have a disabling condition, your die is not cast, and there are individual differences in trajectories, and how can we tap into the strengths that someone might have to enhance their rehabilitation. So the course is taught fully internally assessed. So there'll be 3,000 word essays as the assessment this year. And if you've got any queries or questions, you can contact me or Libby at the RTRU. Would love to have a good group at 714 this year. And so hopefully this has sparked some interest.